Our saga continues. But now we're going to talk about vital signs. And when we talk about vital signs, we're talking about blood glucose. We're also talking about oxygen saturation, capnography, systems like, let's say, Glasgow, neurological assessment. So we have a lot of different topics here. For those who are members, they've already accessed all this content since the day video number 1 was published. So consider becoming a member of the Compartilhar channel. Don't forget to follow, because this will help you grow, make a difference for you, and help you a lot in your daily life. All right, let's go. So we're talking about glucose, right? Glucose, nothing more than a carbon, actually. 6 carbons with 12 hydrogen molecules and 6 oxygen molecules. So, glucose, when you eat, when you have something to eat, that can turn into energy, it can turn into glucose. And what we need to understand first is what glucose is for in our lives. So what is glucose for? Imagine that this is a cell. This cell needs to function. Whatever kind of cell it is, I don't know. Each cell needs to function. And for each cell to function, it needs energy in the form of adenosine triphosphate. What is adenosine triphosphate? Adenosine triphosphate. P for phosphate, phosphate, right? Phosphate. So this cell here generates its own energy, meaning it has its own power plant. And that power plant is the mitochondria, an organelle inside the cell that produces it. As long as there's glucose, right? Glucose enters the cell, and when this glucose enters the cell, it goes through a process of breakdown called lysis. What do we get from breaking down glucose? One glucose becomes a pyruvate. So what do I get? 2 pyruvates. So what is glucose? C6H12O6. What is a pyruvate? It's half. So 1 glucose becomes 2 pyruvates. So glucose doesn't enter the mitochondria. Glucose enters the cell, but only pyruvate enters the mitochondria. I know you've studied the Krebs cycle, the cellular respiration cycle, but it's good for us to reinforce that only pyruvate enters here. And when pyruvate enters, it's the citric acid cycle or Krebs cycle. The famous one that you study in biochemistry is going to undergo a reaction. And in this reaction, my friends, what are we going to have? The final release of flavin, adenine dinucleotide, nicotinamide, adenine dinucleotide, and water. And carbon monoxide? 2. So, once you understand this, is it clear to you? So, we have things that are useless and things that are useful. Well, this here is useless. Actually, it will leave the cell and go into the bloodstream. Carbon monoxide. 2 in the bloodstream can cause problems, but whether they're good or bad depends on the situation. It binds with water to form carbonic acid and bicarbonate. Man, I'm not even going to explain carbon monoxide. 2 here, because if I start talking about carbon monoxide, 2 now, you can add about 3 hours of video just for us to talk about carbon monoxide. 2. Make it 3 more hours, 6 hours of carbon dioxide. Okay, carbon dioxide, man. There are several variables after it leaves a cell. And in fact, it's one of the causes of acidity or mortality for a large number of patients in emergency situations. On YouTube, I couldn't give you this lesson. I have to be my own student and study more deeply. And water, it can help with plasma formation, right? As long as an albumin aggregates, it just as it can be eliminated, it can also be used. Anyway, so to sum up, forget about this here because this is something that's no good for the cell, right? Now this here is, let's say, the source to become energy. But this here is inside the mitochondria. This here is leaving the mitochondria, leaving the cell and going into the bloodstream. Outside, right? And then you do this here, look, and then inhale. You bring oxygen into your body. And that oxygen is what binds to who? To NADFAD. And when the oxygen, let's put it here in blue. So when I have this here, Together with the oxygen, I have energy in the form of adenosine triphosphate. So, when the oxygen goes to the mitochondrial cristae and binds, we get a oxidative phosphorylation. And this generates many moles of adenosine triphosphate. I'm not going to debate whether it's 32, 36, or 38 moles. Either way, it generates a lot of adenosine triphosphate, enough for this cell to be able to perform its function. So, my dear friends, up to this point it's beautiful and wonderful. And you wouldn't be, and neither would I, nor would anyone else. Let's say we wouldn't have bad things. That is, weight gain, fat, triglycerides. But from the moment our carbohydrate intake is higher than our cellular consumption, this cell, if it's a striated skeletal cell, obviously what is it going to do? It will store and start storing glucose. Hey, Hever, that's cool, man. If glucose is stored when the cell needs it, it uses it, that's fine, but what if the person eats more than the body needs? And the reservoir is already full? And now the math doesn't add up. If the math doesn't add up, the amount increases. So if I have more glucose than my body needs, I have the reservoirs here in the liver all full. The body won't throw the glucose away. It will turn the glucose into triglycerides, and then the person starts to have fat and form triglycerides. So if you eat much more than your body uses, what will you have? Extra weight, overweight, obesity, and so on. Not to mention possible diseases resulting from this weight gain, including diabetes, hypertension, and so on. The list grows longer as the weight increases. So, carbohydrates are bad when you eat more than your body needs. That's why using your body is the best thing you can do. Stop being sedentary, okay? After that, here, so what do we need to understand? That in hypoglycemia, which is anyone below 70 milliliters per deciliter, so we have a bad situation for the human body. Because here's the thing, when we start getting to 70, it means the reservoir has already been used. Why has the reservoir been used? Because the reservoir prevents us from having hypoglycemia. So, if you've never had hypoglycemia in your life, it's because even if you went a long time without eating, you had energy reserves. So, when a person goes into hypoglycemia, it's because all the reserves have already been used up, so the bloodstream starts sending whatever it has, and then hypoglycemia happens, and that's very serious. The patient may present with various neurological changes, even appearing to have a stroke, but in reality, it's not. It's just a severe hypoglycemia, and hypoglycemia is something so bad that it can lead the person to death due to lack of energy. So, that being said, what do we need to take into consideration? That hypoglycemia is worse than hyperglycemia, because with hypoglycemia, the person can die right away, while with hyperglycemia, the person doesn't die immediately. Hypoglycemia can kill someone, hyperglycemia doesn't. Its problem can even be long-term, for example, chronic kidney failure. The person can develop chronic kidney disease in the future, they might get retinopathy, neuropathic disease, and so on. So between hypo and hyperglycemia, hyperglycemia is better than hypoglycemia. The management has to be in the emergency room, it has to be quick, but that's for hyperglycemia, not hypoglycemia. The person won't have many changes. In fact, you probably know several people who, on a daily basis, have 200 or 300 milligrams per deciliter of blood glucose and don't feel anything. Today, nothing happens, but in the future, the bill always comes due. You can be sure of that, the bill always comes. So guys, that's basically it, okay? Glucose is our source of energy. We have energy reserves, but they don't last long. Getting stored energy is hard. Turning triglycerides into energy, going back to using them as energy is going to be difficult. So maybe the best way to use our body wisely is to eat less than it needs and use it. Use your body as much as possible, so that you don't accumulate glucose outside the cell. In other words, glucose inside the cell is okay, but outside the cell it turns into fat, which would be a problem. Clearly, everything I told you is just a summary of glucose. I could discuss this in much more depth, But the most important thing for us, especially in nursing, in emergency situations, is to understand that hypoglycemia is not something to mess around with. We need to quickly reverse the patient's condition, and this is one of the main procedures we'll encounter in the emergency room. Hyperglycemia as well, but at least it's milder. In this video, I won't discuss procedures for nurses, doctors, or specific situations. But for our students, they already know, because every class needs a more clinical context, so that you don't just memorize things, but actually retain everything. All right, I'll see you in the next class.